Are you preparing for SCA? Maybe you're not sure about this exam, or you feel that your interpersonal skill is not on point. This is a common problem that GP trainees encounter. Maybe your mother tongue language is not English and you feel that language is a barrier. In this video, I'm going to share with you 3 practical tips that you can use to boost your score in relating to others. Without clarity, it's very difficult for you to communicate clearly. In the 3 minutes period that you have before starting the consultation, it's crucial that you organize your thoughts, you utilize information that you're provided, and have a game plan. Think about what differentials you might need to explore, think about red flags, think about the management, what you might need to discuss. By thinking all this through, then you will have clarity in your mind. When you start the consultation, you are going to be in a better position to start the consultation. So the consultation starts before it even happens. By laying the groundwork and thinking the consultation over before you even start, you'll have clarity in your consultation and you're going to consult more effectively rather than thinking through what you're going to do during the consultation. Tip number 2 is to use simple language. Language is really important. When you use simple language, patients are going to find that you're more relatable. If you're using technical terms and medical jargons, you're going to lose your patient. A common mistake I see GP trainees make is starting to use medical jargons and explaining things in so much granular details that the patient doesn't really understand, and they don't take into account the patient's understanding. So if you want to explain in simple language, make sure that you use a patient's own words in your explanation. Let me give you a working example. If I'm going to explain vertigo to a patient, and the patient has told me that he has been experiencing that his head is spinning and he's been feeling sick. When I explain vertigo, I'm going to use the symptoms and experience that he has been experiencing so that he can understand what I'm meaning when I explain the condition. So for example, I can say to the patient, the crystal inside the ear that can be dislodged, in which case it can send signals to the brain, making you feel like your head is spinning, and sometimes people also experience sickness with it. So by using the simple language and own words of the patient, then I'm building the Lego set on top of each other so that the patient understands what I'm explaining in very simple terms. But if I say to this patient, you've got BPPV, I'm going to lose a patient unless I break it down. So make sure that you're explaining in digestible, short form information that the patient can understand. So chunk and check, bite-sized information, that's more effective. Tip number 3 is make sure that you have alignment in your consultation. This is a concept that not many people talk about, but very important. Sometimes I see GP trainee misaligning their agenda to the patient's agenda. Are you struggling with your consultation skills? Maybe you need help and you want to get constructive feedback. If you'd like to get help, then click the link down the description below to see whether I can help you. If I can help you, then we can enroll you on the one-to-one coaching program. You might find that there's a misalignment in the patient's agenda and the doctor's agenda. What you want to do is find a common ground so that you can work together with the patient. For example, if a patient is looking for a referral to a specialty, but the doctor doesn't think that's needed, then there might be a misalignment in the plan, and the patient might not understand why did the doctor dismiss my request. But if the doctor finds out what's the reason behind the request for referral, maybe the patient is concerned about a specific diagnosis, then the doctor is able to reassure the patient that he or she doesn't think that's the diagnosis there, but then can tell the patient what else could be provided. So then the patient health agenda has been readdressed. And when the patient is understanding that their request has been addressed, then they'll be more open to discuss some management and listen to what you've got to say. But if you don't have that shared understanding beforehand and try to make a management plan, then you won't have alignment in the management, and the patient is not likely to adhere to that plan anyway. So make sure that you have alignment And when you're discussing the plan, involve the patient with you. Make the decision together with the patient and make sure that you readdress the patient's health agenda. If you found this video useful, you might want to watch this video in which I go more depth on clinical management. Click the video to watch it. Take care, everybody. Bye-bye.